Hello, welcome to an episode of One Slide a Day Pathology Essentials. So, today we will be discussing a very commonly encountered disease that you usually see in breast, which is Paget's disease of the nipple. So, before going to the Paget's disease of the nipple, we know it involves the skin. So, as discussed in the previous videos, I think I've discussed the skin normal histology. So, just to revise that, the skin, this is how the normal skin looks like, or the epidermis that you call. So, there is a stratum corneum, which is mostly a keratinized layer, and then you have stratum granulosum where you see some keratohyalin granules, then you have the stratum spinosum and stratum basale. So, you can see how a normal epidermis looks like, and then you have the dermis and subcutis subsequently. So, now that you know how a normal epidermis looks like, so when there is an infiltration of any tumor, you will know how it looks. So, coming to the topic per se. So, if you get an image like this, you know, since we had seen this is how a normal epidermis looks like. So, there's something wrong here, right? So, what do you think there is? So, if you see, we have the stratum corneum, then you have the stratum granulosum, stratum spinosum, and then you have the stratum basale. But there is a problem, right? There is infiltration of some cells. If you see here, some large vacuolated cells are present which are going into the epidermis. And if I tell you that the patient is a known case of carcinoma breast, then you should have a high suspicion of one disease. So, let's come to the high part view. So, here again, how do you describe a Paget cell? So, you know this by now that this is a Paget's disease of nipple, and this is how the microscopy looks like. So, it's an intradermal proliferation of malignant epithelial cells. So, now you know that this is not the normal cells of the epidermis. So, this is an infiltration. And how do you describe this? This is a large cell, right, with an abundant cytoplasm. So, we all know there is a cell, and then you have cytoplasm, and then you have nucleus, and inside nucleus you have a nucleoli. So, whenever you describe a cell, you describe it in that order. So, the size is relatively large. So, how am I saying it is relatively large compared to the small lymphocytes that are present here? So, these cells are quite small, right? And the cytoplasm, can you appreciate any cytoplasm here? No, they have very less cytoplasm. So, compared to that, each cell that you see here has abundant cytoplasm. And if you zoom in again, can you see that there is a large nucleus, and inside the nucleus, right, inside the nucleus, there is a nucleoli, right, there is a round body prominent nucleoli. So, this is how you describe a Paget cell. So, coming to discuss some theory from the topic of Paget's disease. So, the reference is WHO Classification of Tumors, 5th edition, breast. So, what is Paget's disease of breast or nipple? It is an intradermal proliferation of malignant epithelial cells. Now, how do you describe these malignant epithelial cells? We'll just revise what we had studied. They are large with abundant cytoplasm. Again, you have a large nucleus, right? You have a round, large nucleus, and you have a prominent nucleoli. So, you have a prominent nucleoli. So, this is how you describe a malignant cell. Usually, they have a prominent nucleoli. So, what are the differentials that you can think of here? So, since it is in the epidermis, you can think of squamous cell carcinoma in situ, which is also known as Bowen's disease. And then the second differential that should come into your mind is melanoma. So, melanoma cells are quite large, and they are a bit more pleomorphic than this, to be honest, but you have a very prominent punched out nucleoli, like you feel that the nucleoli of a melanoma cell is staring into you. Okay, so they are quite big, and they are mostly eosinophilic. So, these are the two differentials. You have a squamous cell carcinoma in situ and melanoma, but with an appropriate clinical setting of an underlying breast carcinoma, you should definitely think of Paget's disease of the nipple or breast. So, what it is, it's actually an extension of DCIS. So, DCIS is ductal carcinoma in situ. So, just a bit more theory and we will finish this up. So, what is the precursor of Paget's disease of nipple? It is known to be Toker cell. So, Toker cell is where the Paget cell derives or is a precursor of. So, how do you differentiate between a Toker cell and a Paget cell? So, if I am seeing in the microscopy there are some large cells in the epidermis, how do I know if it's a Toker cell or a Paget cell? So, first is the history or the underlying carcinoma. If there is an underlying breast carcinoma or a DCIS, the cells that you see is an extension of that, right? So, it will be a Paget cell. But if there is no underlying carcinoma or DCIS, you should think that it is a Toker cell or a Toker cell hyperplasia. They will not have an underlying carcinoma. Now, if you're confused and you have to confirm it with immunohistochemistry, you have to remember that Paget cells are usually strongly CK7 positive and they overexpress HER2, which in contrast to the IHC pattern of Toker cell, the HER2 is negative. And one more thing is, in Paget cell only 40% of the Paget cells show ER positivity and only 30% show PR positivity, but the Toker cells are usually ER positive. So, this is what you have to remember. Few just will revise. So, it's an intra-epidermal proliferation of malignant epithelial cells. This is how they are on histology, and their precursor is Toker cell. And what is the IHC difference? You have the overexpression of HER2 in Paget cell and HER2 is negative in Toker cell, and CK7 is strongly positive in the Paget cell. So, hope this helps. Thank you.